I am Dr. Nancy Baker. I'm a professor of occupational therapy at Tufts University. I'm an occupational therapist, and I'm interested and have been working in treating musculoskeletal pain for many, many years. I did a study looking at using virtual reality as a way to work with people with chronic pain and to help reduce the pain in people with chronic pain. We found that chronic pain was greatly reduced when people were in the virtual reality headset. A few years ago, I went to a conference on rheumatology, and I went to a session where a person was talking about how they had used virtual reality with individuals with acute pain in hospitals. And I was really intrigued by that. And we had patients with very severe pain that never went away, and they'd had this pain for like 7-8 years. We put one of these individuals in one of the virtual reality headsets, and this individual had pain in the arm. And they tended to carry their arm like this all the time. When we put them in the headset, all of a sudden they started moving their arm normally. It was really amazing. And they were smiling and they were laughing. And when they came out of the headset, they said, "I had no pain in there." And there was just this expression on their face of just amazement and joy. And so a treatment that can both reduce pain and cause fun and joy is a really great way to treat people with chronic pain. There are several different mechanisms which work to help reduce pain in individuals. The most common one that people talk about is distraction. You only have a certain amount of attention in your brain, and when you have chronic pain, that attention tends to sit on the pain. But VR is extremely distracting because you can put people in environments of any type. People can be on the moon, and people can be under the ocean, and people can be in some fantasy land that you've never heard of. And it's very real and it's very engaging. So when you put somebody in there, now they are extremely distracted. Another interesting mechanism of virtual reality is something called embodiment. Our brain is constantly saying, "Where is my body? How is it different from the rest of the world?" And it can be easily fooled into believing that a virtual limb, like your hand or a leg, is the body's real limb. Once you can do that, you can, in the virtual reality, convince the brain that what's causing the pain is no longer there. The last way I see virtual reality as being a really great way to treat chronic pain is that it's a great adjunct to other treatments that are effective. For instance, exercise is really great for people with chronic pain. People work harder and they work longer in a virtual program because they don't even realize they're exercising anymore. All these different ways are some of the unique ways that virtual reality can be used to treat chronic pain. And you can combine them all together, so you're using all three mechanisms simultaneously sometimes in order to improve chronic pain. Because it isn't just the pain that's the challenge for people with chronic pain. It's many other psychosocial and biosocial and other things that prevent people from being able to do what they want to do when they have chronic pain. Virtual reality is, again, one tool that we can use to reduce pain and to help people with chronic pain be able to get back to doing the things that they really want to do again.